back for our roundtable discussion here at the Weiner Wellness Virtual Summit. And today you get Jamie Dorley, CEO and owner of Nutritional Frontiers and the Weiner Wellness Center, and me, Tracy Strout, VP of Education and Marketing for Nutritional Frontiers and the Weiner Wellness Center. And Joe, the Godfather, he may be here in a little bit, but Jamie, our discussion today is really about the medical model. And I love your summation on it. And I think you were the first person to say it about acute versus chronic care. So I'd like to hear your thoughts just to start us out.
Yeah, this goes back a long time ago, right? And what I found out from personal experience is that when you go to the doctor, the medical allopathic doctor, the insurance-based doctor, the quote-unquote regular doctor, right? They are usually using only medications and or surgeries, right? So that's the tools that they have. And I broke a lot of bones when I was a kid. My arm, wrist, pinky a few times. I had a lot of broken bones. Back then, you played a lot outside and different things. So I was used to getting treated for injuries or trauma. And what I found out is that the medical community, right, is fantastic. Their miracle work is for trauma. God forbid you get in an accident, you break a bone, get a concussion, heart attack, stroke, car accident, whatever it may be. The system is set up that they can get you stable, right? And then what, right? The challenge is that the system is set up to treat the sickest and most damaged people, right? So they're treating you for an acute issue. However, we found out, and I did some homework on this for today, in the Journal of American Medical Association, this is going all the way back to 2004, they had an interesting article, Tracy, that looked at treating acute care versus chronic care. And what they found is the medical model, which we are all using, right, or most people, is set up to treat acute care. So therapies such as surgery and medications, even though there may be some risk factors, when you have high challenge, you need high therapy, right? So you have a heart attack, at that point, you'll do whatever it takes to get healthy.
Right.
What they found is that the system is wrong. This is JAMA, the American Medical Association, said that the system is set up incorrectly because the system is set up and heavily funded to treat acute trauma. However, what they found was that 81% of all visits to the medical community is for chronic care. So you have a system set up to treat you acutely, but here you come in with the chronic condition and they don't know what to do. Right. So they're using the tools that they have at their disposal. And I don't think a lot of them are really doing this to hurt people or just to make money or, there's a lot of conspiracy ideas, right? At a higher level, yes. But the local doctor, she got in this because she wanted to help people. She was probably smarter than the average bear. And maybe she wanted to have a nice financial career, right? Be rewarded financially. But most of them get in it because they're smart and they want to help people.
How do you think it moved to that model of doctors being the people that we call up for chronic conditions? Because back in the day, it wasn't like that. Like I can remember my grandmother saying, we didn't run to the doctor for everything. They went if they broke something, if they had something that lasted and lasted and lasted, and the home remedies didn't work. I mean, I remember my grandmother making me mustard plasters for my belly. She was from Germany, so it was all this stuff. And my bop would tell me stories about how he pulled his kids' teeth when they were bad. And I mean, talk about my mom, who's close to 80. So, this model is really only new. So when did it change that?
Oh, it's all positive. You opened the whole can of worms here, right?
All right. Let's go.
I'll try and digest it and get my thoughts out. You're real good at pulling the thoughts out of my head. So there's a few major things that happened in history. One is back in the 30s, Andrew Carnegie, which were right down the street, Rockefeller, right? All the big money in our country decided to back the AMA, right? Okay. And that was okay. What they did is they suppressed all the traditional therapy, Chinese medicine, home remedies, and they backed
Homeopathic.
the medical model, right? Again, I don't think it was for bad purposes, intentions, but it did work out improperly. So that's one. Number two, third-party insurance reimbursement came in. Let me give you an example of why this has damaged the level of care. When I was personal training back in the early 90s, that's the 1990s, so no bad jokes, not the
Back
1890s.
in the horse and buggy
But
days.
yeah, I had a client, he was a cardiologist, right? Dr. Neiman, great guy from Pittsburgh. And he was an interesting guy. So he owned his own cardiology business inside the hospital. Okay. And he came in one day and I was like, Doc, what happened? What's wrong? He's like, I haven't slept for 3 days. I was like, what is going on? I mean, his hair is like all over. He just looked totally disheveled and he was stressed beyond anything I've ever seen with him. And we had a really close relationship. So he says, I just lost 25% of my business. I was like, what do you mean? He's like, well, let me explain how this works. The insurance company that we're partners with came in and said to me, we're cutting your reimbursements by 25%. So just to make the same amount of money, he says, I have a lot of overhead. I own the business. I have all the leases on all this high-end equipment. I have, dozens of employees. He says, so just to do the same number as last year, I got to do 25% more in business. So I think when you start to factor in what's gone on since the 1930s with the changing of the guard from traditional medicines to more of the pharmaceutical and surgical model, then you factor in third-party reinsurance and reimbursement. I remember chiropractors when I was young. There was a lot of old school chiropractors. You drop a $20 bill in a fishbowl when you walked in. That was your payment. There was no insurance. It was one doctor. Maybe his wife worked the phones, and that's what you'd pay. And it even had a sign there: if you don't have a 20, drop in what you can. And the one guy said, as long as you don't take anything out, right? It was like, you don't have
That's
to
my
put
chiropractor.
anything.
He doesn't take insurance here. Like we just go in and it's only check or cash too. There are no credit cards, which I love. I'm like, perfect.
It's like the World of Wellness, the Wine Wellness Center. We're cash based, right?
Yeah.
We do the super bills that you can bill your own insurance. But so I think we start to look back in history. We see that movement change in the 30s. Then you see, I remember as a little kid, the doctor still came to your house with the black bag, right?
Mm-hmm.
The level of care was different. And you mentioned some home remedies. I'm going through all the ones in my head. My mom was big on the aloe plant, right?
Yes.
So we always had
still
that.
have one.
Yeah, we were talking about that. My mom still had the original black salve because I was known to get a lot of splinters because we were always playing in the woods and building forts and climbing trees. So always had splinters or bug bites. So the original black salve was a great drawing salve.
Mm-hmm.
Epsom salts for the bath. So if you had a sprained ankle or an injury or sore muscles, you put that in the bathtub and you soak in there at night. I remember one time I was at my grandma's house in PA. I was very sensitive to bug bites. I got bit by something in the woods and it really swelled up my leg. And they put it looked like oatmeal, some kind of concoction together, and they plastered it on my leg. And they said, don't worry about it. It doesn't look fun. And it cooled it down right away.
Yeah.
I remember driving back from camp with my parents, and I just leaned back on the seat. I didn't know there was a big hornet on the car seat. And I felt the needle go in my back. My dad pulled the car over. He got some dirt, put it in his hand, poured some water, put some mud, and put that right on it. And that took care of it. So, you start looking at a lot of the ways things have changed over the years. So the lack of home remedies, then you look at the Carnegie and Rockefeller changing, the health insurance model, and then it's a perfect storm because 1975, high fructose corn syrup was introduced, right?
Mm-hmm.
I still remember I lived in Queens in New York City. Remember the first McDonald's that popped up in the early 70s, right? So then you factor in the lifestyle therapies, and that's where this thing has gotten totally out of control. And we had to almost reinvent medicine and call it functional medicine, right? Under the guidance of the father of functional medicine, one of my mentors, Dr. Jeffrey Bland. So there's a lot, just like everything else in health, there's a lot of factors involved. But it's really clear as day. The challenge is that the average person Maybe they're not conscious, like Jacqueline talked about, right? They are not even aware that this has occurred.
Right.
So when I talk about, oh, I do functional medicine, people are like, what do you mean? You're a doctor? No. Functional medicine. What's the difference, right?
Mm-hmm.
So I think those are a lot of the factors that I've seen happen, even in my lifetime. You go back further, you get into, even some of the other things that have occurred with lifestyle, right? When I grew up in New York City, we only had one car. It was for my dad to go to work
Mm-hmm.
because he worked about 30 miles away. There was no car for the mom and kids. We walked everywhere. Oh, we did.
Yeah, we had the Oldsmobile when my mom, with the Winston cigarettes, with the door, the window cracked like that much. Like, I think every kid smelled like Winston's growing up in the 60s or the 70s and the 80s. But I want to talk about what you said about treatment. When I was little, I went to the pediatrician, and, I was born in 74. So, you're talking what? A long time ago in a land far, far away.
In fact, May 14th. So happy birthday once
Thank
again,
you.
Tracy. Never gets
Yeah,
old.
never gets old, all day long. But my doctor, Dr. Burkett, who I loved, we would go in there and he would paint your throat if you had a sore throat. Do you remember that? How they would paint your throat with the swabs and they'd put the sweet oil in your ear for an ear infection. I think I got 12 vaccinations, and that was about it. And then we used to get the bubble gum antibiotic if you needed it, which at that time I think antibiotic use was really getting extreme. But my point was the care was different. He looked at my fingernails, he looked at my eyes, like he did my eye test. So there was so much that your pediatrician did as a well visit now. And, I have 2 little boys. They're not vaccinated. So there's no reason for us to go to the pediatrician today. They don't check them for well visits. They may weigh them, but that's about it. I mean, and my doctor that I took my kids to was trained in India. He knew all this stuff. So I would go in there and it was kind of like, oh, you're here. Yeah, your kids are perfectly healthy. And then we would talk about the new movies on Netflix, like Super Size Me or, Forks Over or Knives Over Forks. And you know what I mean? Like, so, but I asked him, I said, why don't you, talk to your patients about like what we're talking about? And we were just having a conversation. He wasn't giving me any recommendations. And he said, I can't. He said, I'm not allowed to do those things where I suggest supplements or suggest this or suggest that. And I think pediatricians have a little bit more leeway than other doctors. They can recommend some vitamins if they're for growth markers, but they can't recommend like alternative treatments. And especially for things like cancers or whatnot, that's an absolute no. Like your license will be revoked.
And you mentioned a great point, right? It's the time factor. So when I bring it back to Dr. Neiman, right, saying his reimbursements were cut 20%, right?
Right.
So think about it. You're a primary care physician, right? You got a beautiful practice in Altoona. I'm the mean insurance guy, and I come in. I says, "Well, Tracy, I'm looking through, and we're going to cut you by 20% this year." So the doctor's solution is to see more people, right? And then at the what? At the consequence of the patient getting less time. And then the hook is to get your prescription refilled, you need to see the doctor every 3, 6, or 12 months.
Yeah.
And that's the medical merry-go-round, as Dr. Weiner would call it.
So why would they cut reimbursements? Insurance companies.
Because they want to make more money. And they're cutting reimbursements for the office visit, right? And they're cutting reimbursements for everything because the insurance company, originally when the insurance companies were set up, the idea was they were pooling everybody's money and then they would disperse it back out. And the idea was, if there's 100 people and it costs them $1,000 a year, one person may need that 100,000, right? For something major. That was the idea of the old insurance model. What happened was the American greed is that the insurance company says, well, hold on a minute. Have you ever heard of an insurance company needing a bailout in our country? Never. Because here's why, right? Now they do is they get the money pooled. Then they determine what their money they need. Then they distribute back to the doctor. So the administrative, it's like a charity. Most charities that are great, they give 10% of their collections. That's why our team at Nutritional Frontiers, we give the money direct to people or direct to a student or give them food or, because I don't want to give it to the middleman. And this is
Right.
what happened with insurance. What started out as a good idea has completely metamorphosized into something that's not great anymore, right? And I think that's the biggest issue is this third party that's holding the money. And, there's some companies that are self-funded, right? I says, well, if you got 1,000, say 100 employees and you're paying $1,000 a month, that's 100,000. You could have your own medical center, one hell of a medical center, right? So that's some of the ideas we'll talk about later. But, there are some solutions to this. Yeah, I've been working on this for a while. There are some solutions to this, right? Because when you give that money to the insurance company, they not only determine what they're going to pay, they've gotten so powerful. In fact, they determine what the doctor can do.
Right. That's one of the things that was eye-opening when you and I went to see one of our practitioners. I was kind of like jaw dropped at that.
And that's what we're dealing with. That's what I've been dealing with since I had a few doctors as clients as a personal trainer. So I got to see that part of it. I have a couple of friends that were in pharmaceutical sales years ago when it was really good. I've had a couple of friends that are doctors, right? And then we're living now at the Wine and Wellness Center because the temptation is to go full insurance, right?
Yeah.
But the challenge with that is some insurance companies only reimburse $18 for an adjustment, right? And then you got to submit the paperwork. So you need to hire a fleet of people to process all the paperwork. And then we got to play the insurance game and see, well, what do we get out of this, right? Is it really worth it? So what we do is that we do a couple things. One is we accept cash payment. It's not much more than a copay. And then we can give you a super bill. If you have medical insurance, you can submit the super bill right to your insurance company and they'll reimburse you directly. They'd much rather write you a check for $40 than send us a check for thousands.
Yeah. So I think just backtracking a little bit on what you said about the insurance companies determining what the doctors can do. Can we get into that a little bit? Because this is a big thing.
Yeah.
People fight for good insurance, right? It's like, oh, give me good insurance. But, as Robert Scott Bell said, the most dangerous thing any person can have walking into a hospital is a really good insurance policy. And what happens, from those insurance companies being so powerful, they determine how much they reimburse, but they also determine how much they reimburse depending on how the doctor treats, what he prescribes. And then doctors actually end up over-prescribing or doing more, even if they know it's not the right thing, just to get money so that they can stay in business. So can you kind of expand on some scenarios?
Yeah, this is a good one. So I'm at a seminar when I worked at Metagenics. I was Southeast Regional. We had two incredible speakers. We had Dr. Bland one day and Dr. Bob Rakowski. And at lunch, you'd have your table of 6 or 8 people. So I'm sitting there with Dr. Bob. I was so lucky he came in last, sat next to me. And there was a cardiologist. His name was Dr. Dean Silver. He was based out of Florida. And he was sitting there, and Dr. Silver loved functional medicine. And he says, Bob, what do I do? He says, in the state of Florida, it's protocol that when someone has a heart attack, myocardial infarction, I have to give the big four cocktail, right? The cholesterol med, the blood thinner, the blood pressure med, right? And the ACE inhibitor. He says, that is standard protocol for a cardiologist in the state of Florida. What do I do, Bob? And Bob says, first of all, Dr. Silver, thank you for coming. You have so much courage to come to this event, and I'm so glad to see you again because you are open-minded and you're trying to do a better job for your patients. He says, however, if you want to keep your medical license, you have to follow the protocol. The fact that you're slipping in magnesium and minerals and CoQ10, he says, that's to be applauded. He says, but you're playing by their rules, and their rules are the big four. So that's one way that they manage the standard of care is by dictating what the protocols are. And again, I don't think they're trying to hurt anyone. There are times you need those medications, right? But it goes all the way down to the lower level where if you go to your primary care physician and he's getting 20% less reimbursement and he's only getting, say, $20 for an office visit, how much time can he spend with you, Tracy? I mean, your hairdresser spends a lot more time with you.
She gets paid a lot more too.
Yeah, not mine, of course, but yours does, right? Yeah, because you're paying for time. You're paying for their time. So now you take a doctor, right? We have a lot of examples of them. And now they're only going to be reimbursed X amount of dollars. And they have all this overhead. They have hundreds of thousands of dollars for student loans. That's the other factor we didn't talk about. How are they supposed to make it work? In fact, a lot of doctors don't make quite as much money as people think they do.
Right.
Unless they're some kind of specialist, a surgeon.
To their surprise as well, I'm sure.
Yes. I was talking to Kevin. He's a business consultant for doctors and dentists, and chiropractors, and he was giving me an example of somebody, $400,000 in student loans.
Wow.
$400,000. He's like, it's gonna take him years to just break even.
Yeah. Right.
And he says, she's a sweetheart. She's a young up and coming doctor. She's excited. She's trying to buy her own practice, and she's getting a lot of resistance from the bank. So there's a lot of factors with this. Yeah, the doctors aren't making the money people think they are. The doctors aren't making the money they thought they were going to make, right? There's a lot of stress because they want to spend. The average doc, if you got her on the Zoom today, I'm not talking functional, I'm talking allopathic. He would say, Tracy, the number one thing I want is to spend more time with my patients.
Yeah.
They just don't have. They don't have it because the way the system is. Because a third party is dictating. We're not even talking about level of care yet. We're just talking about time and finances, right?
Right.
So if they're just in there to do some quick checks and they have to get out of there, they don't have time to talk about water, food. What's your life going on? Do you have any financial strain? Are any of your kids sick? Are you going through a divorce? Have you lost any loved ones? Are you taking care of grandparents or parents, right? All these things that are part of life that affect your health, right? Even the dog agrees. So when this is going on, the doctor has less and less time to see you. And what are they going to do? They're going to focus on the top priority, which is treating you like a trauma patient
right.
with an acute condition. They're treating the high cholesterol patient just like the heart attack patient. And that's where the issue is.
Well, we got a big comment here, though I haven't met Dr. Mazoji, but I've been hearing and seeing his wonderful deeds on people's life. This made me contact him because I was also diagnosed. Okay. Miraculous work in my life. Da, 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 da. So I think, I think people just aren't aware. So what would happen, Jamie, if people actually recognized this model and said, you know what, we don't need insurance anymore? Because, I mean, as Robert says, like, have a catastrophic policy.
Exactly.
Yeah, like have 100%. Something that if something major happens, you need a surgery, you're covered, all of that kind of stuff. But you don't need to carry $700-800 worth of insurance every month that you're never going to use if you're leading a healthy lifestyle. And so it goes back to lifestyle. And then he was saying, if it's a really good policy, look out, because they're going to throw everything on you. So talk about the level of care, the quality of care, and how that has changed with this model.
This is a great topic. I want to thank you again because there's so many. I've lived this for years. I'll give you another example. I was working at Metagenics. They had great health insurance, right? Because they're a wellness company. So I was trying to get into this chiropractor, open a new account when I was down in Florida. He was also located in a health club, so I was getting my workout in. And I did need an adjustment. So I went in to see him. And he looked at my insurance card, looked up and says, wow, you got great insurance. I says, oh, do I get great care? He said, oh, yeah. Now, I paid $100 copay in addition. My total bill was $595 for a first visit to a chiropractor. Thought that was a little extreme.
Yeah.
He did therapies that I didn't really enjoy, like traction. I was like, I don't need this. I didn't like it, right?
Mm-hmm.
So there's an example of somebody taking advantage of the insurance, right? So
Right.
it's a cat and mouse game. They're always chasing each other because one's trying to take advantage of the other. Not all doctors and not all insurance agents or companies, but on a whole, that's what's going on, right? And then you look at the level of care, right? So I got too much care that day. It was an overkill, right?
Mm-hmm.
I didn't like it. Then you got the other side where somebody comes into the office and they should really be talked about, there was a study we looked at years ago. Dr. Bland presented this. It looked at somebody with elevated hypertension, right? Blood pressure, increased blood pressure. And they looked at this study. The idea was to see what impact would lifestyle have on blood pressure versus lisinopril, one of the most common medications.
Mm-hmm.
Dr. Weiner, in fact, said magnesium is the number one cause of high blood pressure and inactivity. That's been supported by UPMC and many, many studies out there. But Dr. Bland, in fact, cited the one research article, looked at blood pressure and one group with lifestyle. It was just a walking program for 30 days. That's it. And the other group on lisinopril. They're about the same. They had moderate reductions in blood pressure.
Yeah.
It wasn't that much different. So the walking could be just as effective as the lisinopril. The reason most doctors recommend the lisinopril is one, is that it's their protocol. And number two, they say the patients don't want the lifestyle therapies,
Mm-hmm.
which some people don't, right? The person is not conscious versus the person who is. And then you factor in things like, well, take someone like me or you. I don't want to go to a conventional doctor. I just do for
Right.
the checkups and stuff. So what do? Well, I save my money up and I go cash to a functional medicine doctor. And she's actually located in the state of Florida. So it's not cheap, but aren't you worth it? Right? Like, aren't you worth a little bit of money?
Well,
People,
it's like I said yesterday, right? We wait for a disease to target instead of targeting health. We wait to spend money on co-pays, and we'll every month invest in a policy that just waits for us to get sick instead of like taking that $700 or $800 and putting it towards organic food, supplements, massage, chiropractic, an appointment with a functional medicine practitioner.
yeah, now they made it so easy. I didn't even know. My daughter came home last weekend. She says, "Oh, I ordered food for you." I'm like, "From where?" Whole Foods. I said,
Mm-hmm.
"What do you mean you ordered it? I gotta go pick it up." No, they delivered it. I opened the fridge. I had my organic chicken in a little container, organic turkey, organic watermelon, veggies. It was like, this is perfect. You couldn't
Mm-hmm.
make it any easier. And
Right.
what's interesting is when you do it like that, Whole Foods and organic food is not more expensive, folks,
Right.
because I buy per meal, right? And I'm not going out to eat. Like the lady yesterday, we talked about it, Panera for lunch, $8. That was without a drink, right? $8 for lunch. It don't sound like much, but it adds up. So you need to seek out, like I think you just said, right? People have evolved to follow the medical model and how they take care of themselves, right?
Mm-hmm.
Because the medical model incentivizes the person that's the sickest.
Right.
Now people are gravitating towards living that style. Hey,
Yeah.
I'm going to wait till something happens. I remember my friend told me years ago, he says, well, by the time I get to that age and, eating like this catches up to me, he says,
You on the round table?
I'm on the
I
round
missed it.
table.
I'm out here. I'm in demand.
Joe's in
Honestly.
bed. Can you believe it? We miss you, Joe.
All right,
Get back out there. We got people looking for you. He says, well, by the time I get to that age, I'm sure I'll have some kind of medicine that will fix this right up. That's the mentality, right?
Yeah.
I'll wait till I get really sick, then I'll quit smoking. I'll wait till I get really sick, then I'll lose the weight. How many times have you heard people get scared to death and now they change their lifestyle?
Mm-hmm. Yeah. Well, that's usually what brings them to the lifestyle change. It's very, and most of the time when I ask people like why they come see me, like, I'm like, what's your reason for coming in today? There's usually like 3 chronic things already happening. and I only asked for 3 because it could be 12, but I just want to be like, what's the biggest 3 you want to address right now? It's very rare, but it does happen that I say, what brought you in today? And they're like, you know what? I just want to be healthier. Like, I know that, my family has this, or I might be prone to this. And, I'm just really seeking to be healthier so I can offset things in the future. And then usually it's like this moment of silence where I'm like, bink, bink, bink. I'm like, what? Like, you want to do preventative health? This is amazing. And those clients are really easy to work with because they're willing and they're not reacting to their health. They're being proactive. There's a lot of difference in your mental state and in your willingness if you're being proactive versus reactive. And that's what I try to get across to people. Like, if you start now when nothing is wrong and you feel good, right? You feel okay right now today, and you start taking the right vitamins and eating the right foods and getting the right sleep and exercising, like, it's a lifestyle. It's not so hard. But if you're sick and you don't feel good, and now you got to change your diet, and now you got to start moving a little bit, and now you have to do these things that are really hard when you don't feel good, it's a lot harder to maintain it, So I think we need more proactive.
Absolutely. We got a couple of questions here. What practitioners see patients at the Wellness Center? Well, we have a whole host panel of different healthcare professionals. We have our best team ever. So we have the captain, Dr. Gideon Orbach, doctor of chiropractic. He focuses on musculoskeletal, range of motion, and function. He's awesome. We have Dr. Phil, the new Dr. Phil, that he does chiropractic, muscle therapy. He also is a sports chiropractic, and he also does a lot of stretching. He works with athletes. He's seen a whole host of new people this week, including kids. He's my daughter's chiropractor. We have Dr. Joseph Hahnemann, who's a chiropractor and a functional medicine nutritionist. So he does a little bit of chiropractic and a lot of functional medicine. We have Jeff Nisnik, who, I tell you what, I've got more compliments and testimonials on Jeff this week than ever before.
Good.
People are really excited. He's in a great groove. He does nutrition, applied kinesiology, and NATE, which is allergy elimination techniques. Jeff is awesome because he'll really test you on, he's got thousands of different things he can test you on and really zero in on what some of the causes are. We have Ashley Rozzi. She uses Zytotechnology, lives the lifestyle, super passionate, and I tell you what, she gets results quick.
Yeah, she does.
Super knowledgeable. She combines that naturopathic with the trainer and nutrition style about her. Awesome. And then we have Adam, who does strictly myofascial release and trigger point therapy. And something to remind people that I learned from Dr. Warner years ago, most pain is due to tight muscles. So if you think it's your joint, sometimes it is, but a lot of the tight muscles around that, because the muscle will go through a guarding process where it really tightens up. So we have healthcare professionals for many different things. Tracy's available by Zoom. You can also stop in and talk to us. You can call us. You can email us. We're here to help you.
Yeah, that's right. Fitz was saying, many people want to take care of themselves when they're already sick. There's nothing like disease to be a motivator for health. That's the sad part of it.
What do you always say to someone who doesn't want to do it? You're not sick enough. You'll be back.
That's right. Yep, exactly. That's happened a couple times, and it sounds harsh, but it's hard as a natural practitioner or even just a healthcare professional in general. When someone's coming into your office asking for help because they're very sick, but they're unwilling to do the things that are causing the dis-ease, right? Like drinking Diet Coke 3 or 4 times a day, eating pizza every night, or going through the drive-through. I had a person that came to my office that drank 3 or 4 glasses of bourbon, and not small ones, like big ones. And she's like, I don't know why I can't get better. I'm like, so I said to her, I was like, you need to give that up. And she did. I said to another guy, you got to give up this Diet Coke. And he said, well, I just can't do that. I said, well, it's not bad enough yet. When it's bad enough, come back. I was like, and you'll be willing to give up anything at that point.
Yeah, don't think that these companies aren't trying to get you addicted. Diet Coke and sugar is more addicting than the hardcore drugs. That was proven in Food Inc. when they did the studies.
Right.
They took the mice and they gave them the option of cocaine or sugar. They'd go for the sugar. And then part
Wow.
2 of the study was each time they would eat the sugar, they give them a little electronic shock. And they kept going back to it. And they turned it up a little bit each time to the point the mouse was getting fried on the inside. It wouldn't stop. It would keep eating the sugar. So
Wow.
this is where we're at on the food part. Now, the poor doctor's sitting there getting less reimbursement. She's got to see more people. She's being dictated by someone who didn't go to, forget about medical school
right?
or college, right? Has no science background. And now she's got to see more and more people. And her protocol to keep her license mandates that she must make sure the person gets these medications. Do you see what this system is broke?
Well, that's what I said. Once I started seeing the pharmaceutical companies coming out with education for pharmacies on how to script products based on symptomology, I don't know if the doctors are awake to this, but they're going to cut you out. Like, it's going to be like the Jetsons. In 10 years, you won't need to see a doctor. You'll be able to go online and put in your symptoms, and a script will be written for you. I guarantee it. Maybe not even 10 years.
It already happened.
5 years, maybe.
Omeprazole used to be a prescription antacid. You can walk into the grocery store right by my house right now, take it off the shelf, and pay for it. You couldn't do that a few years ago. And even on the box, it says, do not take this medication for more than 14 days without a doctor's supervision. Well, what doctor supervises you in the grocery store?
Right.
This is already going on.
Dr. Banana, report to aisle 7.
The guy in the produce department may have more knowledge than the doctor sometimes, right? You know, look, folks, you need to make sure you are taking a step back, digesting, taking a deep breath, and saying, okay, am I at optimal health and wellness? Am I at the right weight? Am I sleeping? Am I pain-free? Is my digestive system working good? Do I have any lack of mobility? Am I focused, right? You have to ask yourself a series of questions. And if you're not, whatever you're doing needs to be improved. And
That's
I feel
right.
like we're all a work in progress. I'm constantly working with new people. Tracy helped me with my health. I have Dr. Basilio Lazari, Len Bransowitz, right? I've met with Dr. Orbach many times. Dr. Phil adjusted me twice this week. I get a massage every 2 weeks, right? I'm constantly investing in myself because I'm trying to keep myself as healthy as possible so I don't have to be treated acutely for a chronic condition, right?
Right.
Now, I'm not perfect. I beat myself up over the years, hard work and hard play. And I got to this point, but I'm like, what do I need to do better now? I have a new person I'm working with next week. She works on spiritual intelligence. This should be fun, right? This is like a whole new area.
Oh, I have to ask who that is. I think I know.
Do you know her?
I think so.
Oh, okay. So
If we're talking about the same person.
is it Florida?
Oh, no. Okay.
Oh, okay.
So someone new.
Oh,
Well, that's good.
Yeah, she's like a friend of a friend, and we just hit it off. And I was like, yeah, I'll try your program. It's for leadership, and they do business training. So I'm going to work with her, and if she's good, I'm going to bring her in for the team. It's just another way. She says it helps you get to where you want to get to. That's all. So I'm always open to trying new things, right? You know, we have Zyto technology here. You can go to an acupuncture. You know, we did the drum circle. That was therapeutic for me, right?
Right.
We talked about things even as simple as music. You know, I sent Tracy a nice cameo today for her favorite musician for her birthday. That make you feel good?
Absolutely. It was like the real thing, almost on a budget. It was like a real thing with a health insurance third-party dictator over it, suppressing the real thing and the real experience. But this is what you get, Tracy, because here's what we'll pay for.
It's like the virtual. It's like almost going to Hawaii. But I just watched the video on YouTube. Right?
Or I just got the story of somebody who just got back. That's what it was like. And then it came with like a sound like whoosh. I was like, it was almost real. So close.
I love what people are saying on here. Krista Green's talking about consistency and perseverance. It's never too late or too early to start a program. Right?
That's right.
You know, I was looking at some cool videos this morning. 2 fitness women, and one was 81 years old. If you saw her, you'd say she can't be over.
I've seen this one, yeah.
And the other one's like maybe 60, and the one didn't start working out until she was 43. The other one, at 56, started working out, and they look fantastic, right?
Mm-hmm.
So it's never too early or too late. So you need to have a strategy in place, right? You can't do it on your own. You need to seek out the help. And look, I feel terrible for most doctors because I know the situation they're in.
Mm-hmm.
They're overworked, overstressed, and underpaid. They're
Yeah.
being dictated to by third-party insurance reimbursable, and they only are really allowed to use pharmaceuticals and surgeries. Now, I'm not saying there's not a time and place, but they forgot the first line therapy, which is lifestyle therapies, supplements, herbs, and food based nutrition.
Mm-hmm.
That's where the foundation has just been pushed aside. And I think that's the biggest concern for me is that, well, wait a minute, we have this whole therapy here, but we skipped. It's like trying to go to college and skipping kindergarten, grade school,
Right.
junior high school. We're just going to go and put you in this. It's like, whoa, hold on a minute. It's a little much, isn't it? And you can always get the drug or surgery later.
Yeah. So it shouldn't be first.
No,
it shouldn't be. And that's what Dr. Orbach was saying. He's like, if you have pain, you have whatever. He's like, don't run to the surgeon first. He's like, try some things.
Yeah. How about a warm bath, right?
Right. Epsom salts, like you were talking about.
For some minerals. Mm-hmm. Yeah. Epsom salt.
One of the things I wanted to ask you, Jamie, with recommendations of supplements from practitioners. I know from experience when you and I visited a medical doctor, he wanted supplementation like as far away as possible because he's not allowed to recommend it. Now, number one, why would that be, right? And two, why do doctors tolerate all of this control over them?
Well, I think it's fear, right? Their fear of losing their license, right? Mm-hmm. A fear of not being reimbursed for their therapies, right? And then I think a little bit of the fear is that they'll be frowned upon by colleagues, right? Or by their or clients or their family or their patients, right? Like, hey, he's not a real doctor. He's using these herbs or these vitamins. However, depending on where you go in the country, the most progressive doctors use all therapies.
Right.
They have lifestyle coaches in their office. They may have exercise. They have meditation. Look at Dr. Ron Shemish. Mm-hmm. My wife went to him years ago. He was having meditation, and he's a medical doctor. How to do meditation and deep breathing. That was his first thing he talked about. And, I think the doctors feel that, they're scared, right? We talked to one recently here, and, well, my attorney told me I can't recommend vitamins. Really?
Right.
Why? The AMA recommends a vitamin. There's prescription vitamins. I'm sure when you were pregnant, they tried to prescribe,
they did.
Prescription prenatals, right? Florastor is a probiotic that's prescription. And in fact, the Ajinomoto, who's one of the largest, they're a $15 billion Japanese company. They provide pharmaceutical grade amino acids. That's 25% of their business to hospitals that they give them IV. So, folks, they're using ingredients, right? They don't want to be looked at as the vitamin salesperson, right?
Yeah.
So I get it. I'll give you an interesting story. This goes back to around 2005. I was in Florida, and this guy, Mark McIntyre, I knew. UPMC in Florida is called Jackson Sands Memorial Hospital. There's like 12 different huge hospital chains. So this guy was all about what we did. So he says, I got to bring you guys in. You got to do a presentation to kind of get the department heads on board. So there's about 17 people in the room. I go up there to do my presentation. I wish you were there. You could have took some of the pounding I got. So I just wanted to present lifestyle to them. That's all. Nothing dramatic, right? And at the end, I was going to show them a meal replacement and a fish oil. That's it. So I went up there. I started going through the Adult Treatment Panel 3 guidelines. That's basically how a doctor should treat a patient that has high cholesterol. Pretty simple. So I put it up there, and it says the first 12 weeks, lifestyle and plant sterols, like something we have in cholesterol red, right, should be recommended. Lifestyle, plant sterols. So it's diet, exercise, water. And the one guy that, it was like half the room liked me and half the room hated me. And yeah, he raised his hand. He was one of the head guys there. Big
Uh-huh.
guy, tall, like really intimidating. And he says, "Well, where'd you get these numbers? You just make them up?" And he's cackling away. I was like, "No, doc, I didn't make them up." "Well, where'd you get them?" I says, "They come from the National Institute of Health. They have the recommendations for the AMA on how do you treat patients with elevated cholesterol." And he was pissed, right? He says, "Well, they must be brand new." I said, "Actually, they're from 2002, but that's why I'm here to show you." And he says, "Oh, no, I've seen this stuff before. What happens is you do the program for 12 weeks, they get improvement, and then the improvement changes and it reverts back." I says, "Yeah, only if their lifestyle reverts back," right?
Right.
So I think the ego factors into a lot of this too. It wasn't his idea. I wasn't his guy, right? And it was challenging because one other guy wanted us in there. And we got a little bit of our program in, but they should have did this program at the elevated level. And I told them, you will be the standard of care in the U.S., and they'll remember you as the guy that started it. But when you're dealing with those big politics in hospitals, and that goes down to the medical, it's really tough. But the guidelines are out there. It's a matter of how did the doctors make money, and do they have time? It always comes back to time and money.
Yeah. Well, it's sad, the way the model has shaped and changed, and and I'm hearing from medical practitioners now, like Dr. Sherry Tenpenny is one, and she says the whole allopathic model needs to be bulldozed off a cliff and start over again. Just start over. If we're recognizing that it's broke, if we're recognizing that we're, the fattest, sickest country in the world, if we're recognizing that healthcare costs are getting out of control, that medications are being made to be non-affordable by people because of money and not because of standard of care. Like when they changed diabetic medications and the generic antibiotic that tripled in expense, there's no reason for that. The production of it didn't change. The negotiation of it changed. The need for it didn't change. So it's just sad that, inflation isn't the reason that most of these price changes are happening in these price wars, and then price wars between insurance companies and reimbursement price wars. And, nobody's getting the treatment that they need or deserve.
Yeah, years ago, we had a patient that really needed an antibiotic. Dr. Water was working with her and said she has an infection. She needs an antibiotic. Okay. He said, they're miracle drugs for the right person, right?
Right.
So she didn't have insurance. The cash was about $325 for the medication. He's like, what? For an antibiotic? This should be like dollars.
Yeah.
So we have 2 European trained muscle therapists. We have Adam, and we used to have Jacob. So they got on the phone. They have friends, family overseas. The medicine was made in the U.S. The cash was $300 and something dollars. It was $16 in Syria. Same med. So they bought it and they shipped it over here for it, right? Yeah. So the shipping cost more than the medicine did, right?
Yeah, right.
They bought the medicine for $16.
Yeah.
Here it was hundreds of dollars.
Well, I think I talked about my friend Christine, who just went over and she had the cancer, the targeted radiation that's only done in, I think it was Switzerland. They flew her over, 3 treatments. The doctors came in and sat down and talked to her for like an hour, like every time. She said, to the point where I was like, enough talking already. Like she said, these doctors just one after the other would come in and just take her whole history again and then pull the chart of the other doctor and do comparisons and write things down and then talk to each other. She said it was the most amazing care she's ever had. That whole thing, all the treatments in 3 weeks in the hospital over there, out of pocket was $11,000. You can't buy a car in the United States for that kind of money. A nice car, right?
No.
Like you can't, like a luxury car, I guess you could say. But $11,000 out of pocket. That would have bankrupted somebody here in this country. If they didn't have insurance, the person would have been bankrupt and not have received the quality of care that she received. And it worked. All 3 tumors were dead inside when she went to one of the surgeons here in the United States, and they removed them because they were all dead. So they were like, okay, you're good. Now that's care, right? And that's also collaboration. But it is sad. It's sad that our doctors have allowed this all to occur, that they're not standing up.
Well,
You know what I
no,
mean?
I think what happens is that they're running on adrenaline like the rest of the country.
Mm-hmm.
They're trying to get through their day, right? They're fighting and fighting and fighting and fighting to get through their day, right? This is a true story. A guy that was one of the head trainers at Metagenics, older gentleman. He had kidney cancer last year. So he went in for surgery to get the kidney removed. They removed the wrong kidney. I mean, this is what's going on, right? How can that happen? Stressed out, incompetence, distraction. Like, there's so many words that pops in my head, right? But how does that happen in the USA? Right?
It's terrible.
Yeah. But, I mean, we've heard it. My son went in for surgery. They took a permanent marker or temporary marker and wrote on his arm because this has happened before.
Yeah.
It's not the first time, right? But I think what happens is you take a pressure cooker, right, and you put someone in there, they're under a lot of pressure. You know, they got to get more surgeries done, and they got to get more people in and more people out because they're being controlled by that third party, reimbursable. So, folks, you need to take the responsibility back in your hands. We have some big plans down the road. We're going to fix this problem. Not going to happen today, but we're working on it.
Yeah, absolutely. Well, guys, you always get the truth here, even if it hurts.
Yes, you always do, and it does hurt sometimes. So
Sometimes. All right, guys. Well, thank you so much, Jamie. That was awesome. And, I really appreciate all the research you did on this and just kind of just laying out the timeline because there was nothing but facts here. This wasn't conspiracy. Doesn't matter where the money goes. It's just like, all right, here's the issue now. And the solution is you guys take your health back and get to the right people who will actually give you care.
I think most people have the best of intentions.
Yeah.
They're just caught up in a system that's not working. That's not why they got into this, to be overstressed and underpaid and not be able to give the level of care. That's why a lot of doctors have gotten to functional medicine, if they even know about it and how they make money. In fact, we have a client of ours that has Revolution Practice, right?
Mm-hmm.
What do? They help doctors get out of the rat race. Yeah.
Yeah.
So it is happening. It's just going to take some more time. So thanks so much, Tracy. You did an awesome job. Happy birthday. It's a big one. Is this 39?
Again, yeah. I just keep getting younger every year. Next year will be 29. Who knows?
Well, you look great. Have a great birthday at the family. Enjoy all the great gifts you got.
Thank you. And thank you, everybody, for tuning in today. This is wonderful. Thank you, Jamie. All right, guys, that ends our stream for today. However, we will be back for our final day of the Weiner Wellness Virtual Summit tomorrow morning at 8:30. So catch us right here. Tune in. Click get reminders on all those links so you don't forget about us, and we'll see you tomorrow.